serving for the city of McCall. I spent 7 years at a university in Texas as chief of police and as an adjunct professor as well during that time frame. And prior to that, I spent the first 12 years of my career working for the city of Arlington in Arlington, Texas. When I left, I was a lieutenant for the police department, supervised 52 sworn officers, and my district that I was responsible for had about 250,000 people in it. So I've progressively gotten smaller and smaller and smaller, and we found a home here in McCall 6 years ago. It's been a fantastic experience thus far. We face challenges just like anyone else does, but the community has always been very supportive for anything that we've done, have been very supportive of us, and we're very grateful for the community that we serve. It is truly a blessing to be in this type of town in which we do get the support that we continually and repeatedly get from not only the residents, but from the visitors, from the businesses and those things. But it's a team. It's a teamwork situation. So we're very proud of that. I was asked to come and speak to you a little bit today about handling difficult persons. During the COVID response, I have been tasked with being the incident commander for the city's response to that. What that means is that I'm in charge of a task force for the city to develop plans, policies, and responses to the governor's orders that came out, the stay home order, now the stay healthy order as Idaho rebounds, and to work with the community in order to get these orders across. And we've got a great team that's put together. Erin Greaves, as you know, has been diligent in producing media. She's worked with McKinsey and the Valley County and the Valley County EOC. And so, excuse me, and Annette Spickard, our city manager, is also on that task force. And there have been lots of people behind the scenes that have put this together, but it's been my job to make sure that everything comes together and we get it out as needed. So with that as well, one of the things that we've been working with are the businesses. In many of these instances, as the businesses have finally begun to be able to be open, or those that were essential in the first place, they've had to deal with persons that come in that don't always want to maybe wear a mask or abide by the rules that have been established by the businesses. And so one in particular I'd been contacted by, and they wanted to know, can we require the use of a mask or personal protective equipment? The answer to that is absolutely. You can require that. You can set those standards. Consider it a dress code, so to speak. You as a business owner have the right to set that dress code as long as it is enforced unilaterally. In other words, you don't pick and choose who's going to do it, but you can ask for that. And so I have seen a couple of instances in which people were a little hesitant or chose not to go into that particular business simply because of the fact that they didn't want to wear a mask. That's their choice. Just as it's your choice as a business owner to say you have to wear that mask. So many times there are people that are going to be upset during that. And one of the things that we do in law enforcement all the time is deal with people that don't want to be dealt with, to deal with people that aren't happy that we're there, to handle those situations. And so it's necessary. It's like any other instance in which you have a, quote, dissatisfied customer, and how you handle it with the face mask is no different. Listen to the person. Be empathetic to what it is that they're saying. Ask them if they're clear on the rules. Be calm. Keep a neutral tone. Be open in your personality. Don't cross your arms. Don't stand back. Be engaging to them and be respectful and hear them out. Make an explanation as to why the rules are there, not only to protect yourself, but as importantly, to protect them as well. You need to validate their feelings. Tell them that you understand. But don't forget that this is your business. You have that right, and you do not have to yield. You can be firm in your tone, but be respectful. That's the one thing that people need to understand when you're dealing with persons like this that don't want to use the mask for whatever reason. Maybe they're on the far right and there's conspiracy theories, or maybe they're on the far left trying to tag me with something or implant me with something. Who knows what it's going to be? People are going to disagree with it. That's their right. Be respectful of their choice, but simply explain to them that they can't come in if they don't wear the mask. Now, the consequences of that are ultimately, if they refuse and they still force their way in, ask them again, be very polite, but be very firm. You have to leave or wear a mask. Your choice, your decision. Supply a mask. One of the businesses in town has done very well at supplying the throwaway paper mask. Supply one. If they still refuse, they are subject to criminal trespass, and that's when I would recommend that if you need to, call the police department. Dial 911. We'll show up and explain what a misdemeanor offensive criminal trespass could be. And that's as a last resort. Typically what we found in this is that if the business owner or the business manager or the employees simply state the facts of why they're doing what they're doing, the reason behind it, and the policies and the protocols and what they're utilizing, the people will either fall in line or they'll choose to go somewhere else, and that's their choice. That is a quick summation of how to deal with difficult people, and something that we do on a normal basis, and de-escalation. But what I really wanted to do was to kind of open it up, and Lindsay and I had spoken about this before the meeting, is to open it up to some question and answers and see what it is, what questions you have of the police department, and what it is that we're doing during this, and what our roles and our responsibilities are, not only from a law enforcement standpoint, but from a service standpoint as well. So if you have questions, I'd be more than happy to take those questions from you at this time.
And feel free to either chime in or use the chat function for those too, if it's easier. Oh.
Justin, I want to thank you for what you just said. That was fantastic. Business owners definitely have the right to control their business. Just like if somebody came into their business without their pants on, you could send them home. If they come in with a loaded lethal weapon, which is the human respiratory tract without a mask on, you have the right to disinvite them. And we really would like for business owners to take the stand that for the safety of their employees, their customers, and the community in general, that wearing a mask in an indoor space in a business where social distancing may not be all that good and ventilation may not be that good, a mask is a safety thing for others. The person wearing the mask is protecting other people, not protecting themselves. I strongly encourage that. It's probably the most important thing we can do to prevent infection in Valley County at this point. I also put on the chat function a web address for anybody that's interested. It's an outstanding article about kind of up to date, up to the minute, about what we now know about coronavirus and how it's transmitted. It's written by Dr. Atul Gawande, who's a well-known neurosurgeon from Harvard, It's very well written, it's very accurate, and it'll give you a good information about why we are doing what we're doing. It really couldn't be better.
Dr. Irvine, that link did not work for me. I don't know if you may check that again.
Maybe check the address.
Same. Yep. It says it's not the page we were looking for.
Let me look. I had to hand type it in.
That's okay.
Because I didn't know how to transfer it, copy and paste. Let me just check. You guys can go along and I'll just look at it for a minute.
I also put on there web, just copy and paste that Aaron had come up with, that handling difficult situations at work. There's a link to city's website. And so it's basically this nice sheet that look at that, you can't see it. If I was more familiar with Zoom, I would share my screen and do that and put it up there, but you can find that. It's a PDF file, and it's basically a flow chart of how to deal with difficult people. But it's nothing any different than you've done in the past. The topic and the reasoning behind it is different. It's the same issue, just a different start, or a different catalyst behind it, I should say.
Chief Williams, how has it gone these first couple of weekends of more people being up here? Anecdotally, anything?
Anecdotally, we are seeing more people. Absolutely. We're seeing more vehicular traffic. We're seeing more out-of-town visitors. And I'm not not sure how many of you have actually been to the Valley or down to Boise in the recent months. I had the opportunity. I don't know if I'd call it an opportunity. I had to go down a few weeks ago. This was prior to rebounds, actually, I believe. And during that time frame, I was at one of the big box stores buying home supplies. And maybe 1 in 12 persons was actually wearing a mask in the particular store. The employees weren't wearing masks. They were having lunch together, sitting in the break room. People were walking around with their babies in their arms, no social distancing. It was like everything was normal. This was almost a month ago that occurred. It probably was actually a month ago. And so today what we're seeing in town is that we have a number of persons coming up from the Valley or visitors coming in from other locations, be it California, Washington, Oregon, wherever it may be, that are not accustomed to wearing the mask on a daily basis and while in public. And so we are seeing more and more persons come into our community that aren't wearing masks. And so we're starting to have to deal with those persons. Our calls for service are starting to increase simply because we see more people. However, the community itself still remains diligent. Most of the persons within the community remain diligent and respectful and have taken those extra steps. The business community led the way in the beginning of this by voluntarily closing their doors prior to any orders coming out, simply because it was the right thing to do. And so that is something that, that you as the chamber and Valley County through their PIOs, as well as the city and our PIO, have diligently put forth, is to come here, be respectful, be mindful of what it is that we're trying to do within our community and assimilate to our community, destroy it. And so it is going to be more difficult once we see larger crowds that are going to be coming, perhaps this weekend, depending upon the weather. How are we going to deal with those large crowds? How are we going to deal with those people that refuse to social distance? How are we going to address specific situations? And so we've been playing through those scenarios as an emergency operations center and as incident command chief for the city of McCall. Our staff has been working on that. We're already progressing into stage 4 right now for our planning and how we're going to implement different philosophies and policies and protocols during that time frame. But yes, we are seeing more people and we only anticipate more.
Does anybody have any specific questions or want to share an experience they've had since opening their doors?
County is requiring masks. And Justin, I don't know if you got the phone call or not this week, but we did have someone very upset. We were able to handle the situation. And I don't know if they ended up just leaving or putting a mask on, but you know, Justin asked how we're going to handle this. We're going to handle this with care and grace. We are a caring community. We're going to set a great example by wearing masks. And I think if we all hang together, that is really what's going to set the example and make everybody feel more comfortable. The county's requiring masks. The city will be requiring masks. So as government and businesses partner together, if we all do this, it's just going to be all of us in this together. So I think people are going to get used to it here in this area rather quickly if we all hang together and require it.
Thank you, Sherry, for sharing that. Something else I think is worth noting, and I think Dr. Irvine said this in a different meeting, but obviously safety first with all of these guidelines and, you know, I wear the mask to protect you kind of thing, but it's also to keep businesses open. We don't want to go back into lockdown. We don't want to close our doors. We want to stay open. So the more people, I think that's a valid thing to address in your own businesses as well, that it's because we want to keep moving forward. And the more people that wear masks and abide by distancing guidelines and washing our hands, the quicker, you know, ideally we can get back to life. So let's see, may have, okay, a question was asked. They're curious what the police department's protocols are for wearing masks as a force while you're in the field and if you do go into businesses.
So what we've done is previously and prior to this is if we are in the office, the city policy is that you are wearing a mask and that you will wear a mask if you're in city offices. If you're working outside and you are a single person, and you're working by yourself, you do not have to wear a mask. But if there's more than one person involved, then you do have to wear a mask. So as a police department, what we've done thus far and what we will continue to look at, as long as the recommendations are the same, is that when we are in the field, we are not wearing a mask unless we are in a specific situation in which the person has known symptoms or there is a higher risk with that particular person. We have been wearing masks when we go inside of residences and things of that nature. But as a blanket rule, there is not a blanket rule that we have that you have to wear a mask each and every moment, because there are safety considerations, not just medical, but physical safety situations with wearing masks and everything that we have and what we have to do and being able to speak clearly and be understood. So there are certain situations that we will have to forego one for the other. But as a whole, we follow and adhere to what the city policy is.
It looks like there are questions about people who are asthmatic and masks, and maybe this is a Dr. Irvine question too, because I am unfamiliar with the impacts of masks on if you are potentially asthmatic, but if they refuse to put on a mask because they are asthmatic. So is that a thing, Dr. Irvine or Chief Williams?
The short answer is no, it's not a thing. There will be people who will state that they have a medical contraindication to wearing a mask, that they have a health condition that disallows that. There are very few health conditions that disallow the use of a mask. We have asthmatic nurses that work in the operating room all the time and do just fine with a mask all day long. What I would say is that if they have a note from a physician that says that they have a contraindication for wearing a mask, that you should honor that. But unfortunately, people are using medical excuses to not wear masks illegitimately, and that's a tough situation. You want to take them at their word. You want to understand if they have, and be understanding and be kind. But I see nothing wrong with insisting on a note from their physician, a signed note stating that they have a medical contraindication of wearing a mask.
I would agree with what Dr. Irvine just said. You can take them at their word, but validate it. It goes along the lines, in my personal opinion, of how people get dogs on the airplane and the therapy dogs in those situations, is that I have this condition and I have to have this. Well, you can take that, but you can also validate that. And if there was a medical note and it looks legitimate, that's better to err on that side than the other.
A business had just mentioned that they feel it may be nice if all businesses were required to have a mask policy of sorts, but legally, I don't, what is the answer for that? I know you're not a lawyer, but nor would I ask you to be one.
Yeah, no, I'd refer you to your legal counsel on that one. And so what we see is the differentiation between businesses, and some businesses that you will find that are locally owned, that are the smaller businesses, are going to be the ones that make that policy and implement it very quickly and very rapidly. If you go to the two different grocery stores in town, you'll see two different philosophies many times. In the beginning, one was not wearing any mask at all. Now I went through the other day and every one of their employees are wearing masks. Finally. I mean, we're only 3 months into this, and we're all wearing masks, and that it was very good to see. However, what I saw now was none of the customers were wearing masks. So we're going to swing this pendulum back and forth, but I do not believe that there is a standing right now at this because many of these things are already being challenged, and it's going to be interesting to see what the courts say and what ultimately the Supreme Court has to say on if there is standing for this. And so you will not see, in my opinion, from having listened to the governor for the last 3 months on this, getting a feel for what his recommendations are and what he is doing, I do not believe that you will see a blanket mask policy that comes out that says everyone will wear a mask. I just don't see that happening. And so it'll be up to the individual business, the individual person, to make that decision as to whether they will or they won't. And from there, hopefully, as Sherry mentioned earlier, that example will be set. And so we, as the business leaders, as the community leaders, as the government leaders, must set that example and lead by example. Don't ask someone to do what you're not willing to first do yourself. And so that's what we are trying to do right now.
Yeah, I agree with that. I also, it is a CDC recommendation right now that all individuals going into indoor public spaces, it's recommended that they wear a mask. So you do have that legal armamentarium, is that the CDC is recommending it at this moment. And
that's a recommendation. It's not a requirement.
It's not a requirement. It's not a law. Nobody's made a law saying it has to happen.
Right.
But it is a recommendation.
And that's typically what we've been following as a city. We've hung our hat, so to speak, on the CDC recommendations, the CDH recommendations, medical recommendations, recommendations from the state, that this is the best practice. And so that's what we as a city and our policies and protocols that we've been and carrying out thus far have been those recommendations. So we use that quite often. But when push comes to shove, there's a difference between a recommendation and a mandate.
Somebody also asked about, recommendations or opinions on patrons and restaurants wearing masks. And I think Suzanne Mack's on the line too, but my understanding is the requirements that are in place for restaurants to reopen make it feasible so you can still, in theory, eat your meal without a mask, correct? Correct me if I'm wrong, but.
I don't know, so I wouldn't know. Restaurateurs, anyone?
Yeah, you're correct.
Thank you. So I think the idea, at least, I'm not an expert, and Dr. Irvine and Chief Williams, feel free, but I guess you could recommend that people, or require it as a business, that people wear masks when they enter your restaurant or go to and from the bathroom, or however you see fit. I guess that would be up to you. And obviously, while they're eating, they can't be wearing a mask. But
it comes back to the initial question: can you require? And absolutely, any business can require. You can make it part of your protocols or part of your quote dress code to have that mask when they come in. And if they're not eating, then that's up to you to make those decisions as the business owner, as the proprietor, and what you feel comfortable with. And so if you want to make that a mandate, absolutely you can. And if you do not have to, it's a recommendation. Yes, it's going with the grain of what is, quote, the right thing to do. But if you choose not to, that's your choice as well.
Yeah, two things about that in terms of the science is that one thing that is being recommended to restaurants, if it's at all possible, you're a lot safer outdoors than you are indoors. There is a lot better ventilation, a lot less likely to spread the virus in an outdoor setting. So if restaurants can socially distance in an outdoor patio or something like that, there are cities that are closing off streets and letting the restaurants move out onto the streets and so on. You're a lot better off in that circumstance. Also, something we've learned about the virus is that the viral load that you get as you inhale it is a time-related thing. The longer you're breathing that cloud of virus, the more likely it's going to be incorporated. So if you can spend less than 15 or 20 minutes is what seems to be the case in the indoor setting, breathing, potentially breathing the micro droplets that are created by speech and laughter and singing and so on. If you can do that for less than 15 or 20 minutes, you're better off than if it's for an hour, for example. Those are two sort of science-based things that can help guide restaurants as to what to do.
thank you. Chief Williams, I know you have city council tonight, so in the spirit of time and getting a little break before then, does anybody have any questions for Chief Williams directly before we?
While you got me, take advantage.
Somebody, a littler person in the group asked if you caught any bad guys today.
I did not today. So I'm sitting in the kitchen working remotely today. So unless there was a bad guy that came through and tried to beat me to my sandwich earlier, no, I didn't.
No bad
But we could put you in touch with someone that might have.
Listen, if you ask all the bad guys not to do anything bad right now because you don't have time to deal with them.
I think I may have tried that earlier during this and may have been told that wasn't the best idea. So,
Chief Williams, if somebody does get to that point where it requires maybe police interference, if you will, or invitation, I think was the word you used.
intervention.
Intervention, yes. I mean,
There you go.
is the best thing to do to call 911 at that point, or the non-emergency number, or what's the best?
I always tell people when you need a police officer, dial 911. That's the easiest number to remember. You don't remember the non-emergency line. There's a reason that there is a 911. All the calls get screened anyway, and so they're on a priority basis. And don't feel like that if you dial 911 that you're going to be ahead of someone else if there was a shooting or a robbery or something of that nature. You're going to get bumped down. It's a triage, just like in the hospital. When you go into the ER, if you're not as serious as someone else, you keep getting bumped back down the line. And so if you need police service, call. We would much rather people dial 911 and request a police officer and then us get there and not need us than to have it the other way around. It's better to have and not need than to need and not have. And so, yes, our recommendation is if it becomes a situation that you feel uncomfortable with, that you feel threatened in, or that you feel that your customers or your staff are threatened, please do not hesitate to call us. We are not so busy that we cannot come to your business and help you out. That is our job. That's our responsibility. And that's the service that we provide.
Well, thank you so much. I know I've apologized many times on a 911 call to dispatch because it always feels weird to do it. And you know you're being broadcasted all throughout, but everyone has always been incredibly courteous and respectful. And so we are immensely appreciative and so glad that you could join us today. I guess it's one of the benefits of being virtual is that we got you on the line. So thank you
Absolutely.
again. And he did link the city's website in the chat, and we can relink it as well. So thank you so much, Chief. And
thank you for the opportunity, and I appreciate it. And should any of you have questions offline, I'll try to figure out here. Put my email address. It's williamsj@mccall.id.us. If you have questions, if you would like us to give some training as far as de-escalation tactics and things go, please don't hesitate to contact me. We will make those arrangements. As I said, we're here to serve the community. And then during this time frame, we're serving in different ways that we had never anticipated before. But that's what you do. You adjust and you make the best of the situation. So again, thank you for the opportunity. And I'll look forward to working with you all as I go off to City Council now. So have a great evening.
thank you so much.
Bye.
Well, that was really helpful, and I think that's pretty amazing that we're able to have these leaders in our community be on the call today. So thank you. Dr. Irvine, you are up. He came from surgery this afternoon to be on the call with us. He also has performed both of my knee surgeries. When I was living in Montana, I came back to McCall to have them done. So Dr. Irvine, thank you for being with us.
Yeah, that's a HIPAA violation.
Oh, well, but it's self-professed.
Anyway, my main goal in being here was related to the message about masking. I truly believe that that's the most important thing that we can do as a community is get indoor spaces, get everybody masked if we possibly can. I think that'll make a difference. It reduces the risk of viral transmission by the person who has the virus, who's wearing the mask. It reduces their risk that they're going to give it to somebody else by 90%. And that's pretty well based in science at this point. So if we can get, everybody in indoor spaces, in public indoor spaces, you don't have to wear it at home, obviously, or in your car, as long as you're, with your family or by yourself in your car, but any place in an indoor space. I did put that Atul Gawande article. It looked like the address was correct when I put it in the chat space, but I did put a Google search that will get the article right away. And I checked it. And if you just type in the Google search that I put, you'll get that article. And it is very informative. And reinforces a lot of the things that we've been talking about. This is a very rapidly changing environment, as you all know. That's one of the things we get criticized for in medicine, is that our advice changes with time, but I see that as a positive thing, not a negative thing, in that as we learn more about how this virus behaves, how it's affecting people, what it's doing medically, we should be changing our advice to adjust to what we know about it. So don't see that as a negative, it's a positive. I'm here otherwise to answer questions that anybody might have.
I did have a question for you.
Mhm.
It says, a friend who is unable to drive has asked that I drive her to her medical appointments and grocery shopping. Are cloth masks enough, or should we both be wearing N95 masks? And actually I had this question the other day for myself as well, if you're riding in the car with somebody else. Oh, hang on, Dr. Irvin, let me unmute you.
No, I did. I unmuted
Okay.
myself. I remuted myself. No, a car or an airplane or any place like that is a closed, poorly ventilated space. If this isn't an immediate member of your family that you live with, you can assume that you're sharing all organisms with the people that you live with, and you need not worry about that. But if it's somebody that you don't live with, a mask is a very good idea in the car. It turns out that a 2-layer fabric mask is almost as good as a surgical mask. That's actually is addressed in Dr. Gawande's article. And N95s, if you can get them, are fine. They're hard to wear. They're hard to breathe in. They're not very comfortable. And they only give a few more percentage protection against transmission of the virus. The more important thing is that you wear a mask, and a double thick homemade fabric mask is just fine.
I'm actually really surprised to hear that. I think that is new. That seems like new information from when we first
Yeah,
started.
well, that's addressed in Dr. Gawande's article, and it turns out that the reason it's fine is that the person who is shedding virus, the person who and may not know it, so you don't know who in a partnership, who in two people interacting with each other might be shedding virus. If the person that's shedding it, it turns out that the vast bulk of the droplets that are being expelled as that person talks or coughs or sneezes, of course, are caught by the mask. And they die very quickly in the mask, as it turns out. So that's where the benefit of the mask is in the sender of the virus, not the receiver.
A question that just came through the chat. What about people that clean houses or just short-term rentals in general? How long should we wait to go into a property after guests have left? And should we be wearing more than a cloth mask at that point?
Well, that's actually a very good question. And we're learning more about the survival of the virus on surfaces. Picking up the virus on surfaces is harder than we originally thought. And is not as common a mode of transmission. It still can be transmitted by you touching a surface that has been had virus shed on it while it's still alive, and then touching your face, which is why you don't want to touch your face. But a cloth mask, again, is fine in someone else's house. And I would just wash my hands very frequently, at least every hour. Because washing your hands gets rid of the virus that you pick up on your hands, which is quite frankly how you're going to transmit it yourself. The virus isn't going to jump off a surface into your mouth or nose. It's going to use your hand as a transport. So if you're washing your hand frequently, that works very well. And soap and water is just fine for washing your hands. Also, disinfectant wipes, if you can find them, are great on surfaces that may have been touched a lot or sneezed on or whatnot. But I don't think we have to get too freaked out about viral transmission on surfaces. It's actually not as common as we thought. You should be careful, but you don't have to be paranoid.
There are questions about the virus in the air. I know the particles or the droplets, I guess, is how it's transmitted, and how long do those sustain in the air?
Yeah, back when dinosaurs roamed the earth and I was in medical school, it was referred to even then as droplet nuclei. They're little micro droplets that you can't see, you can't feel. It's not like what you feel on your hand if you sneeze into your hand. Those are big droplets. These are little aerosolized droplets that float in the air, almost like a fog that you can't see. And those droplets can remain suspended in the air after ordinary conversation for up to 8 to 15 minutes is what's been quoted. And they can float and depending on how the ventilation is working in the room and so on, they can go fairly long distances, maybe up to 13 or 14 feet rather than the 6 feet that you hear. So the key is ventilation, having basically air movement, and remembering that these droplets are floating around for quite a while after ordinary conversation or laughing or singing or coughing or sneezing. And that's where the masks are so helpful, is that if you're talking with a mask on, it's going to catch the vast majority of those micro droplets.
We've got a lot of questions coming in the chat, which is great, but it does put you on the spot. So somebody asked about what is temperature taking? Is that effective for businesses or employers?
Yeah, the main thing about taking temperatures is finding symptomatic people. And that's something that your employees and folks that you work around, you need to be encouraged that if you're sick in any way, you should first and foremost isolate yourself and then call your family doctor about, whether the symptoms that you're having could in fact be related to the COVID virus. So temperature taking is just one way to figure out if you're sick, but it's only a relatively modest percentage of the patients with early symptomatic COVID disease that have a fever. It's just one more way we can screen to find out if you're sick. And so, a lot of places will take the forehead swipe temperature, and if somebody's above 100.4 degrees Celsius, or degrees Fahrenheit rather, then it can be assumed that they've got a fever and that they may be sick and they should be checked out. And possibly have a nasal swab and be checked for the virus, have a PCR test. But that's just one more way to screen people to find out if they're sick. But if somebody has a runny nose or a sore throat or something that you might ordinarily think was a cold, in this environment, that should be discussed with their physician to determine if there's a possibility that they're becoming ill, and then get screened.
The next question is, things that do kill the virus. Does hydrogen peroxide, this person specifically asked?
And I don't know the answer to that. I'm not sure. I've seen that published. The most common disinfectants are things that are either bleach-based or the traditional disinfectant-based circumstances like Lysol and so on. I honestly don't know if hydrogen peroxide kills it.
I know alcohol at a certain percentage, right? I'm blanking on the percentage and up.
60%.
Okay, thank you.
And that's what's in classic. Dylan gave us a toast there. It's 60% alcohol, 120 proof if you're drinking it, I guess. Does kill the virus, but that's related to hand sanitizers. If you're using an alcohol-based hand sanitizer, it should be at least 60%. That's things like Purell.
Right. Is there any effectiveness from air purifiers using them in a shared space?
Not that I have read about. Again, there are HEPA filters and really super fine filters that can actually filter out viral particles. And we use those in hospital settings, for example. But even in hospital settings, we use negative pressure rooms where when we have a known coronavirus place, a patient, so that the air is rapidly recirculated. But I don't know that commercially available home air filters and so on are tight enough to filter out the virus.
Let's see, I was just looking. Does anybody else have any questions about the virus or about ways that we can effectively stay healthier? So if I'm understanding you correctly, do not be overly paranoid, but be consistent about distancing, washing our hands, wearing masks. Do you have any other pointers for us?
And isolating if you're sick or one of your employees are sick. The employees definitely need to be encouraged that if they are becoming ill, have symptoms that are concerning for either a fever or respiratory symptoms, and that's any respiratory symptom. One of the symptoms that you've all heard about, I'm sure, is that's unique to this virus, or not completely, but definitely we see it in some patients with this virus, is the loss of taste or smell. If you can't smell or taste anything, that's a surprisingly common symptom of the coronavirus. So, but if you have symptoms that are concerning for a respiratory problem, also gastrointestinal symptoms can be a symptom, especially diarrhea.
We have some questions coming through about any testing updates or where, any statuses on cases in Valley County, where we're sitting with those aspects.
Yeah, and the important thing when we talk about cases is that we always talk about known cases. I have no doubt that there are cases of COVID somewhere in Valley County. And that's one reason we should all be taking the precautions we take. The good news is that through our testing center at St. Luke's McCall, we've had no positive COVID cases on patients who live in Valley County. We've had some from Adams County. We've had some from Idaho County. We've had some from other places that have tested positive, but we've had no Valley County residents test positive at our testing center. Crush the Curve was up at Shore Lodge a week ago Tuesday and tested Shore Lodge and Brundage Mountain folks. And my understanding is that none of the PCR tests that were done there came back positive, which means that they found nobody that was actively shedding virus, which is great. That's fantastic news. There were some antibody tests, but that all an antibody test means is that you previously had the virus and you have antibodies to it at this point. Doesn't mean that you're immune necessarily, just means that you have antibodies.
Somebody just wanted to clarify about short-term rentals and the time they should wait from when a party exits the home to when they can safely go in and clean it.
Yeah, I think if you can wait 24 hours, you're pretty safe, because on most surfaces, the virus is dead in 24 hours. There are some unique lab type circumstances where they've been able to document that the virus was still present up to 3 days later, but those are lab circumstances. They're kind of idealized circumstances, and the amount of virus that they're finding in those circumstances is almost certainly not infectious. It's not enough to cause an infection. So I think if you wait 24 hours, you're fine.
Okay. Thank you for clarifying that. And I do want to let people know that the St. Luke's Foundation is graciously ordering disposable masks for businesses specifically. So if you are interested in obtaining some of those, obviously they're contingent on delivery, and obviously there are delays, but please reach out to the chamber office or Jenny Rumley at the St. Luke's Foundation. So we're working with them to help distribute those to people who've requested them so far. And then additionally, the state of Idaho has their availability for PPE for small businesses as well. And I will link that in the chat. I don't know, I'm curious if anyone on the call has requested any of those from the state. Let me post it here. Oh, it looks like Broken Horn Brewery has. And Jenna, have you received those?
No, I haven't even received confirmation that they will ship. It was just a request form. And I didn't order everything that they had, but the items that I haven't been able to find at that price. They were more affordable than a lot of other places that I've looked. So I ordered a few things from them.
Okay. And then Laura Crawford from St. Luke's mentions that Governor Little's holding a press conference at noon on Friday regarding COVID-19 testing strategy. So as a chamber, we're doing our best to send out as much information as we can without annoying you, but hopefully you don't find them annoying and you find our email blasts informative. But does anyone have any more questions for Dr. Irvine? I'm curious, Dr. Irvine, the asymptomatic versus symptomatic, that percentage.
Yeah, again, we're learning about this. This is not something that is absolutely definitive, but what we're finding out is that somewhere between 30 and 50% of people who are shedding virus actively are completely asymptomatic. It's actually one of the confounding parts of this virus is that many people who are actively shedding virus don't know they have the disease. And the reason that is confounding is that those folks are out wandering around the community and think they're fine and in fact can be infecting other individuals. We think that's one of the reasons why the R naught on this virus, which is the number of people that on the average that each individual that has it spreads it to, is somewhere between 3 and 5.5. And that hasn't been totally determined yet. But this is a very contagious virus, and it may be largely because a lot of people are infecting others when they are asymptomatic. When we have a virus where somebody gets sick immediately when they get it, they pretty much know that they need to go home and go to bed. In this circumstance, they're out wandering around in the community. So this asymptomatic spread is a big deal and of great concern.
A lot of people are chiming in. What is the best way to find out if you are shedding the virus if you are asymptomatic? Are there any indications?
There are no physical indications. You wouldn't know it. The only way to do it would be to get a PCR test. But because of the relative shortage of PCR testing even now, that's not always easy to do. They did test, Crush the Curve came up, and as I said, a week ago Tuesday, and tested a whole bunch of asymptomatic people, and they were all negative. That's great, but if they came in contact with the virus the very next day, they then could be infected and shedding virus. That's the problem. And I don't know that we're going to necessarily be able to test all people every day. That would require billions of tests that we're just not going to have. So the best way to know is to be intuitive. Did you travel somewhere where you had a high likelihood of having been exposed, or have you been exposed to a known COVID positive patient? Exposure is very important. And if you have, you should probably be tested. And if you've had a suspicious exposure, you can get a test. Or if you have symptoms. If you're starting to get symptoms, you have some body aches, muscle aches, joint pain, runny nose, cough, sore throat, fever, loss of sense of taste or smell, you want to get tested early because then you'll know. So exposure and symptoms are going to be your best way of determining that you may be shedding virus and infecting other people. But that's why universal masking in indoor spaces is so important, because there's still going to be folks that don't know they have it, that don't have a known exposure, don't have a reason to suspect.
Do you have any tips for us moving forward? I know for me, socially, I still feel awkward. I know the recommendation is 10 people or less still. Do you have any tips for people as we start, to socialize more, and recommendations for how to discern if you should attend a gathering or not? Yeah,
I would say that outdoor gatherings are far better than indoor gatherings. Staying at least when you're in an outdoor setting, staying 6 feet apart. If you're indoors, wearing a mask. If you're concerned and outdoors, wear a mask. I think we can get together and socialize in groups of less than 10. but need to be apart, need to be distant. Remember that cloud that's around you if you're shedding virus that other people could be breathing in.
Somebody asked, what is your opinion about kids in the community getting together? And I don't know if they're speaking specifically to some of the, I'm not certain what they're speaking to specifically. Maybe they'll type in and clarify.
Yeah, kids are a real conundrum because thank goodness kids don't develop active COVID disease of any significance. There are some kids that have gotten sick, but with the active disease. Now, this Kawasaki-like syndrome that's been described is a very rare immune complex disease that occurs about 30 days after COVID exposure. It's really quite rare, and it's not unique to COVID. Other viruses can cause these kinds of immune complex syndromes, but it's concerning that small children have been diagnosed with this. We thought kids were pretty much, out of the woods with this thing, and now we've got this immune complex thing. It's not something to worry about. Kids are seen to be pretty protected, but remember too that kids can be a vector. They can have the virus and be shedding it and give it to their grandparents, and the kids are almost certainly not going to be symptomatic. So if a child's been exposed to someone with the virus, they can be giving it to their grandparents, and of course that can be lethal. So.
Okay. And then somebody just mentions that be leery of buying certain materials on Amazon for PPE. Make sure it's a legitimately vetted source. There are a lot of cheaper products that use questionable materials.
I totally agree with that. Early on, we were looking, I bet I had 100 emails from well-meaning folks that were giving me people that they knew in China that had N95 masks and would ship me a pallet full of masks tomorrow for the right price. And we were looking for N95 masks for healthcare providers. When those things got vetted, when we looked at them more closely, many of those were scams that were not N95. They weren't what we were looking for. So be cautious about there. Unfortunately, when we get a crisis like this, the scammers show up in spades. So always be suspicious, be careful, watch out for the phony stuff.
And then somebody else writes, is anyone in town selling PPE yet? I have seen, I've seen masks at Ridley's. I know May Hardware did have some. And I'm blanking on other places that maybe had homemade masks as well for sale. But if you are interested, we can certainly track some down. But I do know May Hardware and Ridley's had them at one point.
Yeah, the other thing is that Mask Valley County, the group of angels among us who have been making masks, I know have a pretty big stockpile of homemade masks.
Yep, and then also Ken Ryder, thank you for reminding me. McCall Print Shop, Idaho Shirt Company is making them as well, and you can customize them and put your logo on it. So it looks like Rustic Outlet also has some. So there are people that do have them in town.
It's a good one, Ken.
I was just making sure we got everybody's questions. Does anybody else have anything to ask Dr. Irvine before we conclude? There are a lot of people saying thank you, Dr. Irvine, for your passion. And yeah. Do you want to leave the business community with any parting thoughts or encouragement for us?
I strongly recommend you read that article that I gave you the link for. It is perhaps the best article I've seen in this 2 or 3 months or whatever it's been that we've been struggling with this. It's very well written, very understandable. It'll make good sense to you. So if you get a chance, take a look at it. And I thank you for having me. We're trying to get the word out.
All right. Thank you, everybody. This was a great event, great evening. So thank you for participating. Thank you, Dr. Irvine, and thank you, Chief Williams.
Arrivederci.
Okay. Bye-bye.